Today, I will explain the HINGE method in digital transformation, focusing on its application in unit Kesihatan UiTM. The HINGE method is a strategic approach that connects external environmental changes with internal organizational work process. In other words, it ensures that digital transformation efforts are not carried out randomly, but are driven by real external pressure, risks, and opportunities identified through horizon scanning. In the context of unit Kesihatan UiTM, the hinge point exists between external pressures such as a public health expectation and digital healthcare trends, and internal operations such as patient registration, medical records, and appointment management. So this connection ensures that internal changes are relevant, justified, and future-oriented. So what is horizon scanning? Horizon scanning is a systematic process used to identify emerging trends, technologies, risks, and societal changes that may affect an organization in the future. Instead of reacting to problems when they occur, horizon scanning allows organizations to anticipate change and prepare strategically. So there are four main external environments in influencing unit Kesihatan UiTM. First is from a technological perspective. There is increasing adoption of digital health systems such as e-health platform, telemedicine, and electronic medical record. Mobile applications are widely used for health monitoring and appointment booking. Data analytics is increasingly applied to support preventive, healthcare, and decision making. This development indicates that healthcare services are moving toward digital and integrated systems. Secondly, from a social and demographic perspective, so students now expect fast, online, and self-service health services. There is a greater awareness of mental health preventive care, and a growing student population increased demand for efficient and scalable health services. This creates pressure for unit Kesihatan UiTM to improve service accessibility and responsiveness. Thirdly, from regulatory and policy perspective, there is strong emphasis on data protection and patient confidentiality, including compliance with Personal Data Protection Act or PDPA. Health services must align with Ministry of Health Digital Health Initiative. UiTM policies also encourage a digital campus transformation. Therefore, health services process must secure, compliant, and digitally aligned. Fourth is health and risk environmental. The COVID-19 pandemic highlights the importance of contactless services, digital screening and reporting, readiness for remote consultation. This lesson shows that healthcare units must be digitally prepared to handle future health crises. So what is happening now? At present, many university health units, including unit Kesihatan UiTM, still rely on manual or semi-digital patient registration, fragmented medical record, walk-in based appointment system, limited data integration across services. So as a result, several issues arise such as long waiting time, data duplication and error, limited visibility for health planning and reporting. This current state shows a gap between external demands and internal capabilities. So based on horizon scanning, the future direction for unit Kesihatan UiTM includes a fully digital patient journey, from online registration to treatment record, integrated electronic health records or EHR, online appointment and queue management system, use of data dashboard to monitor health trend, potential integration with teleconsultation and student health application. This horizon reflects a shift towards student-centered, efficient, and data-driven healthcare services. So based on this analysis, the selected work process for digital transformation is patient registration and medical record management. So why this work process is selected? This work process is selected for several key reasons, such as high frequency and impact, which is every student interaction begins with registration and record access, so any inefficiency at this stage affect the entire service flow. Second is data-centric nature. Registration and medical records generate critical health data, which Digital system improve data accuracy, accessibility, and security. Third is strong alignment with external trend. So this process supports the global and national move towards electronic health record. So it meets student expectation for fast and online services. Fourth is high risk if not transformed, which is manual record increase the risk of data loss, confidentiality breach, inaccurate or incomplete medical history. So using this HINGE method, the rationale can be explained clearly, which is external environmental, digital health technology, policy expectation and user demands are increasing, which is the hinge point is patient registration and medical records act as the connection between this external pressure and internal operation. So the internal response by digitalizing this work process, unit kesihatan UiTM can improve service efficiency, ensure regularity, enhance quality of care, prepare for future health emergency. Therefore, this work process functions as a strategic hinge that enable effective adaptation to environmental change. In this session, I will present the internal audit findings using the HINGE method. Within the HINGE method framework, internal audit evaluates whether an organization's current work process, resource, and capabilities are adequate to respond to external digital pressure identified through horizon scanning. So for unit kesihatan UiTM, the internal audit focuses on identifying existing work process, available skills and competency, perform gaps and roles and capability structure. So this assessment is essential before any digital transformation initiative is implemented. So the primary work process assessed is patient registration and medical record management. So currently, this work process involves walk-in patient registration at the service counter, manual or semi-digital data entry using paper form or basic system, physical medical files stored in cabinet, limited integration with other UiTM system. So this process is central to daily operation and directly affects all downstream clinical services, including diagnosis, treatment, and follow-up care. So skills available within unit kesihatan UiTM, which is the internal audit, identifies several strengths in terms of skill. Firstly is clinical skills are strong. Doctor and nurse possess solid medical knowledge and patient care competency. Secondly, there is a basic digital literacy. Most staff are familiar with basic computer usage, simple data entry system, email communication, and internal UiTM platform. Thirdly is administrative skills are well established. Front desk and support staff are experienced in managing patient flow, filling records, and coordinating appointments. However, the audit also identifies several critical skills gaps, including limited expertise in advanced health information, lack of capability in data analytics and health reporting, insufficient awareness of cybersecurity and data privacy requirements, limited experience in change management and digital process optimization. Without addressing this gap, digital transformation efforts may face resistance or inefficiency. So what is currently working well? The internal audit highlights several internal strengths, which is clear separation of roles between clinical and administrative staff, establish standard operating procedure for patient handling, strong institutional knowledge among experienced staff, high commitment to student welfare, and continuity of service. This factor provide a stable operational foundation for digital transformation. So what can be improved? Despite this strength and several areas are identified. So firstly, process efficiency. Manual registration leads to delays, repeated data entry, and longer waiting time. Secondly, data accessibility. Physical records slows down information retrieval and limit reporting capabilities. Thirdly is system integration. The lack of linkage with UiTM student database increase administrative workloads. Finally, skill development. Staff require structured training in digital health system, data protection and new workflows. Next is key roles and responsibility. The patient registration and medical record process involve multiple roles, which is the unit Kesihatan officer or medical officer in charge is responsible for overall governance, compliance, and approval of process changes. Administrative officers and medical assistants handle patient registration and record management and data entry. Doctors and nurses are responsible for clinical documentation and updating patient medical records, while the UiTM IT unit, in a supporting role, manage system maintenance and technical troubleshooting. Clear role definition is important to ensure accountability during digital transformation. So the number of personnel involved is 1 unit Kesihatan officer or supervisor, 2 to 4 administrative or medical assistant staff, 2 or 3 nurses, 1 to 2 medical officer, and 1 IT support personnel, usually shared at the university level. This demonstrates that the work process is cross-functional, involving both clinical and non-clinical staff. So the HINGE method justification is from an internal perspective. The HINGE method can be summarized as internal audit finding, which is existing process are stable but largely manual and fragmental. Second is HINGE point. Patient and registration and medical records serve as the connection between staff skills, data flows, and service delivery. Next is transformation readiness. With targeted skill development, improved system integration, and process redesign, Unit Kesihatan UiTM is ready to transition from traditional operation to a digital model. This confirms that the organization has the capacity to hinge towards the digital transformation.
In the HINGE method, the new model generation occurs after analyzing the external horizon and also the internal environment and identifying the keyword for the process. At this stage, the organization designed a new operating or service model that leverage improved digital maturity to deliver a greater value. For Unit Kesihatan UiTM, they are mostly focuses on the patient registration and also the medical record into an integrated and digital health service model. For the leveraging improved digital maturity, Unit Kesihatan UiTM moved from manual and fragmented processes to integrated data-driven and user-centered health services. Digital maturity is reflected through integrated digital platform, data standardization, interoperability, staff competency in digital system, and also secure compliant data and also management. Third is propose a new business or operating model in a keyword integrated digital student health service model. The key characteristic of the model is data supported decision making, centralized electronic health records such as EHR, preventive and proactive healthcare services. And what we can conclude is this model position Unit Kesihatan UiTM not only as treatment provider, but it is also for a health management and prevention hub within the university. So what is the suggested improvement to current system and digital patient registration and appointment system? So for the current issue is the staff and also the student have to manually go to the Unit Kesihatan just for the registration, appointment booking, and it also have issue in the queue management. Apart from that is automated confirmation and reminder. So for the impact of it is reduced congestion, faster service delivery, and also improve student experience. So for the integrated electronic medical record, the current issue is the paper-based or fragmented medical record limit data, accessibility of community of care. So what improvement that we can use based on the digital transformation is improve accuracy and continuity of care. Other than that, there's faster retrieval of patient history, and then stronger data governance and also compliance. And then the current issue in the health data analytic dashboard is limited use of data of planning and prevention. What improvement that we can do is dashboard showing common illness, peak visit period, and also the health trend needs. Other than that is early identification of outbreak or recurring health issue. So the impact of that is evidence based on the decision making, better resource planning as the data already on the digital record, then support for preventive health programs. And for the digital screening and the teleconsultation, the current issue is all consultation required to physical visit, which the student, staff and also lecturer need to go to the unit Kesihatan in order to make a digital screening or teleconsultation. What improvement that we can do based on the digital transformation is online health screening form and also basic teleconsultation for follow-ups or minor cases. The impact of it is it will reduce workload for physical clinics, increase accessibility for others, and it will improve services resilience during emergencies. So what is the solution and recommendation for the current system? First, for the short-term recommendation is digitize registration and record as priority, which is in the HINGE process, and then conduct staff training on digital health programs, and then strengthen data privacy and cybersecurity awareness. And what is the second one is the medium-term recommendation, where we recommend for integrated unit Kesihatan system with other UiTM platforms, and then introduce data analytics for health planning, and then redesign again the SOPs to align with digital workflow. And for the long-term recommendation is expand into preventative and predictive health services, leverage AI-assisted health insight for the future ready, and then position unit Kesihatan UiTM is as a model digital campus health center. So for the gap analysis in the HINGE method, within the HINGE method, gap analysis will compare the organization, the current state, and with the future desired state, based on insight from horizon scanning and internal audit. The purpose is to identify gaps that must be addressed for successful digital transformation. So the current state is patient data recorded manually or in isolated system, and it uses paper-based medical record dominant, high risk of data duplication of inconsistency, so it will use more time as it uses manual paper, and then limited ability to health trend analysis. For the future state, we can centralize electronic health records, standardize and structured data, secure, compliance, and easily retrievable information. Data analytics used for health planning and prevention, and identify gap, and lastly, lack of integrated data system and analytic capability. So for the current state for people is strong clinical expertise among doctors and nurses, administrative staff experience in manual workflows, high reliance on individual experience than the system. And for the future state, digitally enabled staff capable of working with health information system, and the digital role and accountability will be more clear, and it will reduce dependency and manual handling, and we will identify the gap and limited exposure to advanced digital healthcare system, and it will change resistant risk due to familiarity with manual process. So for this skill, the current state is they use basic digital literacy such as data entry and system navigation, strong medical and administrative skills, minimal knowledge of data governance and cybersecurity. And for the future state, competency in EHR usage and digital workflow, and it will understanding the data privacy, PDPA, compliance, and cybersecurity. And also will ability to interpret dashboard and reports, identify gap, and also need for structure, digital skill training, and continuously upskilling. For the system processes effectiveness, does the current system facilitate work effectiveness? So the current situation is manual registration increase waiting time, physical record slow information retrieval, post-system integration increase administrative workload. So for the better future situation is automated registration and appointment system, faster access to accurate of data, streamline workflow to across roles, and the gap will identify. And lastly, the current system do not support efficiency, scalability, and also service quality. So what is the beneficiary of digital transformation? First is student, and second is faster registration and reducing waiting times. Third is better continuity and quality of care, healthcare staff, reduce administrative burden, and then improve access to patient information, then management and also the university, and then the report will be better and the planning capabilities, then it will improve compliance and risk management, stronger preventative health initiative, and lastly enhance campus health resilience. Part of the weakness on this digital transformation, first is over dependence on manual and paper-based process, so it will use more time and the process will be a little slow. And then limited data visibility and analytics, vulnerability to data loss and confidential breaches, then inefficient costs by fragmented system, and lastly skills mismatch between current capability and future digital needs.